Welcome to Your American Dream. I'm Anisha Jennings, and today we're exploring how one dentist is revolutionizing oral healthcare. Join us as Dr. Misheal Artani shares her vision of dentistry that goes beyond the smile to embrace total wellness. Welcome, Michelle. I'm so happy to have you here.
Hi, Nisha. I'm so happy to be here.
Thank you. Thank you for your time.
Likewise.
So, you came here from Pakistan when you were a very little girl. Tell us
Yeah.
about your journey from Pakistan to here and how you went into dentistry and how you started your own dental clinic.
So it wasn't actually a very linear journey. I was, like you said, born in Pakistan. We moved here, my family and I, when I was probably around 2.5, 3 years old. My dad moved here for work, better opportunities, the American dream, why most of us ended up here. So we initially moved, to the US in the early 90s, and I did all my schooling here. Started from pre-K to kindergarten to elementary, middle, high school, did everything here. During schooling though, like dentistry was never really on my radar. It wasn't like I was little and like since then I was like, I want to be a dentist. It wasn't like that. It kind of just happened. I grew up in New Jersey. I went to high school in New Jersey, and then I went to Barnard for undergrad. When I started undergrad, I was on the pre-medical track, like a lot of immigrant children are, because, that's what we're told we should be doing. So I did the whole pre-medical track. I took my classes. I was always interested in the sciences, but I even went as far as taking my MCAT. I took the MCAT. I was ready to submit applications, but there was something in me that was kind of just holding me back. And so much to my parents' dismay, I took a year off after undergrad to kind of do some soul searching and figuring out what I actually wanted to do. And that's when I came on dentistry. I worked with a few dentists, I shadowed, I did a lot of kind of exploring into the profession. And then I was like, you know what, let me go for this. So that's when I started studying for my DAT. I took that exam, I applied to dental school, and the rest, as they say, is history.
Yes, yes, lovely. So, what was your parents' reaction when you decided to take a break, and how did they support you in this journey?
To be completely honest, they were very disappointed and they were like, that's it, you're just not going to go back to school. They didn't have high hopes that I would, pursue and go on to like do anything in the medical or dental field. But I proved them wrong. I took a full year and I feel like that year really helped me kind of solidify and choose dentistry because I feel like if you're forced into something and you don't really love it, you're never really gonna grow and be good at it, right? You'll just do it because you have to do it.
Mhm.
Dentistry is one of those things where I came upon it. I really liked what I saw. I went all in and I did it because I wanted to do it. Dental school is hard, it's not for the faint of heart. Same with medical school. It's not short. It's not like a 18-month program or something. You're in it for years, 4 years of training, additional residency, and then the learning never stops. Like even now, 10 years later, I'm still taking so much CE that like I feel like I'm still in school sometimes. So I'm glad it worked out, but it was much to my parents' dismay. Now, obviously, hindsight, it's 2020, right? So they're like, "Oh, we're so proud of you. We love it." But it took a while to get here.
Yes, that's kind of how it works.
Mhm.
So, what inspired your interest in functional and biological dentistry?
So this came about more recently during COVID. We were all kind of home, right? I was not working. Dental offices were closed, and I had a lot of time to just take CE classes online because everything was pivoting. Everyone was pivoting. So I took a course on airway dentistry, airway and expansion in adults, sleep apnea. And then when I got into that, it was a whole curriculum. It was maybe like, I want to say 200 hours like of CE. So I did all that. I did the whole course. And then one thing kind of led to another. I was introduced to people who were like, oh, have you heard about this? Or are you doing this in your practice? And at that time, I was working as an associate. So even the CE I was taking, I wasn't applying any of it because the dentists who I was working for were either unfamiliar with it or didn't want to be doing those kinds of things in their practices. So, I went to work and I did what I was asked, but eventually it got to a point where when you know something and you see something, you can't ignore it. So I got to a point where I was seeing patients, I was seeing kids, and I had done all this training and education, and I would be like, hey, we should think about it a little differently, but that requires really pivoting from traditional dentistry. And much to, my bosses, all of them, their dismay. They're like, what is going on? This has to stop. So I kind of got to a point where I was like, if I'm going to do this, I have to work for myself. I can't have somebody telling me you can't do it like this. You have to meet certain numbers. You have to do production. You have to do this. All of that is important. I get it. But, at the end of the day, I want to go to bed knowing that I did the very best I could for my patients. I gave them their options and then we go from there. But I don't ever want to feel like I force someone into doing something without their full knowledge.
Awesome. That's amazing. So seems like you're a trendsetter. So how has that helped you? Like it seems like, you have taken a stand and said, no, this is not what I want to do, but this is what I want to do. How has that helped you evolve in your, personal life, professional life, and you as a person? How has it helped you grow?
My practice focus is a lot about choices in education. Coming from overseas, I'm not even first generation, right? My kids are. So I know the kind of struggles like my parents went through every time we went to like a doctor's appointment or somewhere. They were they kind of just did as they were told. Nothing was ever really explained. They weren't ever given like options or choices. Thankfully, no one ever had any like substantial health issues that we were dealing with, but even the little things, right? A lot of times I see parents that come to me and obviously they haven't been to dental school, so they don't know the science and stuff behind it. So they're kind of like, well, do I have to do this? And my philosophy for treating people is really to educate them so that I can help them make their choices, right? I don't want to dictate what they should do, but I want them to make informed decisions so that they're comfortable with it. So even kind of in life now, I've kind of adopted that philosophy. It's not just doing something because I've been told, it's really questioning the status quo. Like, why am I being told to do this? Is this my only option? And is this the best option? Like, is this what I should be doing? Kind of not just accepting things for where they are, because I feel like as a society, like everything is so accessible to everybody, right? We really have no excuse to be like, well, I didn't know. Like everything is available at our fingertips. I'm not like encouraging you to go be Dr. Google, but you have all these resources available to you, even like the journals and the studies, and everything is available to the public now. So there's really no excuse for us to make about our health or the choices we make. It's ultimately like on us. The choices we make make us entirely responsible for what we've done. And I want people to have that ownership. It's very empowering. Even now, as a practice owner, as a mother, like I kind of go through these same thought processes, like for my kids when I'm helping them make decisions or I'm deciding what kind of after school activity or thing they should do, even something that little, it's still, I want to give them those choices and be like, what do you want to do? What do you want to try? And it's okay if it doesn't work, right? Then we'll try something else. It's not a big deal.
Yes, that's amazing. And you have been telling us about, what sets you apart and how making choices and educating people is like your top priority. So what sets you apart from traditional dental offices besides this?
It's a lot of figuring out the why before we get into the how are we going to fix it, right? Everyone goes to the dentist usually for two reasons. Something's hurting or they want a cleaning. But the focus is never really how can I prevent problems from happening, right? So yeah, sure, come for the cleanings, come for the fillings. We'll do all of that. But if you do have a problem, whether it's something as little as a cavity or like bleeding gums or, bigger issues like missing teeth and stuff, we really want to figure out why that happened. How did we get here? And how are we going to go forward so that this doesn't happen again? So a lot of it is really putting together like different pieces of the puzzle, right? So it's looking at the mouth, not just as the mouth, but looking at the mouth as part of your whole body. So our first focus is the body, like systemically, how are you doing? Medically, what are you dealing with? We do a lot of additional testing, right? Saliva testing to test bacteria, saliva testing to test biocompatibility of different materials, because what works for me may not work for you, right? Even what works for me may not work for my sister, who's genetically very similar to me, or my brother, or my cousin, or whoever, you know? So a lot of it is understanding that each individual has a very unique blueprint, you know, their genetic makeup, their bacterial makeup, everything that's going in them and how they process that, and really understanding that like to its core before we start just jumping and saying crowns, fillings, dentures, whatever you need, you know? So that's kind of what sets us apart. A lot of times people come in the first appointment, they're like, well, why aren't you doing my cleaning? And I'm like, well, it's not just a cleaning. I have to figure out what kind of cleaning you need. We want to be able to know which kind of bacteria we're up against, what we're doing, so that when I do your cleaning, which is not ever just a simple cleaning, you know, we're targeting what's ailing you so that you heal better and you heal for what you need to heal.
That's very good. So, how do you integrate overall wellness into dental care?
So a lot of it is, you know, seeing the connections between oral health and physical health. One of the big ones is bacteria in the mouth, right? Bacteria in the mouth, there's good and bad. The bad is obviously indicative of disease, and that bacteria is, if it's in your mouth, it's in your body. It's only one way in. So that bacteria, with a lot of the recent studies, has been linked to systemic disease. There's a host of different bacteria, like there's millions of them, right? But there's a handful that are aggressive in the mouth, causing issues like periodontal disease, gum disease, decay, cavities, things like that. But those bacteria have also been found in very high concentrations in people who later go on to have things like hypertension, high cholesterol, heart disease, stroke, dementia, Alzheimer's, diabetes, right? So when we do a saliva test, I often equate it to like a blood test when you go to your primary care doctor, right? Nothing has to be wrong. We're just getting a baseline. Where are things? How can we prevent things from happening? Or are we good where we're at, you know? So it's really about taking a proactive stance to your healthcare rather than a reactive, not waiting for a diagnosis and disease and being like, okay, now what do I do? But more being like, what am I at risk for? And how can I decrease these risk factors so I'm never diagnosed with anything at all, as far as I can control it, you know? So a lot of emphasis is on prevention. And sometimes people come in here and they're like, wait, how are you like doing this? Because even with like dental disease, right? Things like cavities and stuff, I'll be like, hey, do you want to try remineralizing this? Do you, before we jump into things like fillings and crowns and all of that? Obviously, there's like a limit. I can't remineralize everything, but there's tiny, tiny cavities
Yeah.
options, right? Like the remineralization. So we don't have to jump into treatment. We can be more proactive. We can change our habits. You know, little habits where normally you go to the dentist and they're like, oh, you have all these problems because you're not flossing, right? But what if we give them a chance and say, hey, if you floss and you can stop this disease from progressing, then, you know, you're golden. We don't have to do any treatment. So it's really bringing in those options so that people are more motivated. If I just put a filling in and I do your cleaning and I say, make sure you start flossing, what are the chances you're going to do it? Probably zero. You know, the next time you'll floss is when you come here 6 months later. But now, if I've given you the education, I'm telling you exactly what you need to do to prevent me from having to treat you, chances are you're more likely to, you know, maybe take that on and do the treatment. So it's really at that point, it's about giving them control, right? I've given you all the information I have. I'm giving you also a chance to stop this disease from progressing. Now it's on you. Are you going to do it, or are you going to come back and then I'll do your fillings? You know, either way is fine, but I really want to give patients that kind of feeling of empowerment. I want them to have the control over their health.
We need more doctors like you. So, what are your thoughts on fluoride?
It's a loaded question. I personally do not use fluoride. I am not going to tell you, hey, don't use fluoride. It's bad for you. I'm going to show you the research that's pro fluoride and who it's been sponsored by and when it was done. And then I'll also show you the research that's against fluoride and who that's been sponsored by and who's kind of leading the studies, and I'll help you make an educated decision about whether or not it's right for you. Fluoride is one of those things where, yes, it has had proven benefits, but I'm one of those people where everything has to be in moderation. It can't be fluoride in your water, fluoride in your toothpaste, fluoride in your vitamins, fluoride in the food you're eating. It can't be like just fluoride all day long. You have to know what's going in your body. And a lot of patients don't. One of the questions we ask on our intake forms is, what's your water source? And is your water fluoridated? In New Jersey, water is not fluoridated. 99% of my patients are in New Jersey, and on their forms, at least 85% of them will say fluoridated water. So, it's about awareness and knowing. Like, we drink water all day long, right? Whether it's coming from our tap, whether it's coming from a bottle, whether it's coming from wherever it's coming from, we should know what's going in our bodies. So, one of the reasons I ask that question is so that we can kind of double check and be like, are you sure you're getting fluoride here? What kind of toothpaste are you using? Is it fluoride or fluoride free? And it's not really how or what kind of toothpaste you're using, it's how you're using it. Is you or your child, are you just blobbing it on and eating it, or actually brushing your teeth, right? Eating it is not going to help. It has to be on the teeth. So, to answer your question, I personally am not a fan of fluoride for myself or my family, and I'll leave it at that.
Thank you for answering that.
Yeah.
That's generally what comes up in most dental visits is, that's a question. So I just wanted to know your thoughts on that, and thank you for answering that so well. So what cutting edge technologies are you implementing?
We have everything is kind of digital now. We're beyond the era of kind of, goopy impressions and everything on paper and all of that. So we're a fully digital practice. One thing we do is a 3D CBCT scan that helps us assess your airway, the volume of your airway, how well you're breathing, as well as all the dental and, oral anatomy and makeup. And another thing we do is everything is scanned, right? We no longer take impressions, even for if you need a crown or if you decide to do any sort of treatment that's fabricated outside of our office. It's basically a camera. It looks like a little camera on a stick. It goes in your mouth, and that gets us all the information we need. So those kinds of things are really, where it's headed. One thing we're hopefully going to be implementing soon is 3D printing in office. So that's really kind of nice too, because it gives patients direct kind of access to treatment. So there's no longer like a waiting period for, we have to send something to the lab, or we have to wait on somebody else to manufacture it and send it back to us. Now with the technology, it's, we can do everything almost immediately and to such extreme precision because it's all done digitally, that it's like next level, unheard of.
Lovely, lovely. So how do you balance running an innovative practice with family life?
It's hard. It requires a lot of support and planning. And, my business is also very new. We just finished our first year, and I have to give it to my husband, who has been like, honestly, my rock. Like, he has been the more supportive. We have two little kids, and little kids require a lot of time. A business requires a lot of time. And, he also has his own full-time job. He's not in dental, or, he's not working in the office or on the practice. He's working his full-time job and managing all that. So it's really a balancing act, right? I'm not going to say it's easy, because it's definitely not. It requires a lot of help, and it requires a lot of understanding. And honestly, kudos to my kids too, because they see me working at home, or like, I'll put them to bed, and then my daughter will sometimes ask me like, "Oh, are you going to work after you put me to sleep?" I'm like, "Probably." So, they're really understanding, and they're honestly the reason I did this. I went into it because I was initially dealing like with their own health issues and figuring things out for them, and that's kind of where it grew from. But even till now, I remind myself that it's for them. Eventually I hope to get to a point where it will allow me more time with them and to be more present with them. And already it has, because as the owner of the business, I dictate my hours. So I really do it so that I'm working while they're in school. If they're off, I'm home with them. And there's really no job that would allow me to do that otherwise. So we're in like the growing pains sort of phase right now, and I'm grateful to my family for being so supportive and understanding. But I'm hoping as, we move beyond this first phase of starting a business, we'll get into, better times ahead.
Yes, that's lovely. It is a teamwork, it is a team effort, and kudos to you for, taking making this choice and, following through with it. So, what's your vision for the future of dentistry?
It's really to empower patients and focus on the prevention, be more proactive. And that requires a shift in patient mentality, right? There's always a dentist is not something people are like, oh, yes, I'm going to go to the dentist, right? It's really like, how long can I put this off? Because nothing is hurting, so I'm fine, right? Because the last thing you want to do is go to a dentist, you have zero symptoms, and they're like, hey, you have 12 cavities. Right? Like that happens a lot. But my view or my vision would really be to shift that focus, right? Like, how can we encourage patients to want to go and find out ahead of time, find out early when problems are small and not bothering them? And how can we encourage them to be proactive, right? And a lot of that is education. Like, how can we get that awareness and education out? And one of the biggest things I hear from patients is, I never knew that was an option, right? When I talk to them about different things, it's because I feel like the way dentists have been kind of ingrained is just, as bad as it sounds, like produce, 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 right? Like there's a reason dentists have a bad reputation. But I really wish we could just shift it into produce to prevent, 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 right? I feel like there's always going to be patients that don't follow your advice and don't prevent. So you'll still have plenty of treatment to do. But for the ones that will, like it could be honestly like life-changing for them. And that's what I would envision dentistry to be at one point, where it's not something people dread. It's not something people avoid and put off until they're in pain. It's something, hey, let me get this checked because this could be like the first glimpse into what's going on in the rest of my body, right? We're all busy. We all have so much going on. And a lot of times healthcare takes a back seat, especially if you're not symptomatic, right? You're like, oh, I'm fine. I was at an office once and I forget the exact quote on the poster, but it was like health is not just the absence of disease, right? Health is really about longevity and your quality of life and how it's going to be long term, right? So just because you're good in the moment right now and there's no visible signs of disease doesn't mean there's nothing going on inside. We all have a lot going on inside. The earlier we find out what's happening, the more proactive we can be. Because once you have a health issue, that's honestly all you do, right? People who've, unfortunately been diagnosed with cancers or broken a bone or done something, life is on hold and it's all about your health. Without your health, there is nothing. Everything is meaningless. So I really want people to start thinking of their mouth as part of their whole health, not just, hey, I need a cleaning or a whitening. That's all great too, but be more proactive and find out things while you're still healthy, while you have the time to do these things, rather than waiting and then being like, oh, okay, now I can't go to work because my tooth is hurting. I got to take my kid out of school because their tooth is hurting. Like you have to pick when you're going to utilize that time. Is it going to be when you're healthy or is it going to be when you're, you know, in pain or sick? So are you going to be proactive or reactive? It's really up to
Yes, lovely. Well, listening to you, I'm definitely encouraged to come see you.
you.
So, how do you plan to expand your impact on healthcare?
Honestly, education. I feel like education is the best thing we can do for anybody in the society, right? If we give them the knowledge, then they'll be more inclined to act on their own. Even with my patients and myself, I tell them you don't know what you don't know until you know it, right? And then when you know it, you have to do something. Like if I can tell you your risk factors when you come in and then you choose not to do anything, then that's a choice you're making, right? So at least it's an informed choice. Even with the way I treat, before it would be like unheard of to start treatment on like a 4-year-old or even a 2 year old, right? It'd be like, oh, just wait till they're older. But now, like the things I know, like if I don't give you options at that age, I would be like a disservice to you. So I think education and knowledge is the best way to move forward.
So, with your experience so far and everything that you grew with, what would be your advice to aspiring holistic healthcare providers?
Just keep pushing, keep going forward. The majority will always look down on you and be like, what are you doing? This is a bunch of like, it's just most people don't believe in it, to put it nicely. There will always be people who are bringing you down and you're like, why are you doing it this way? Or like, is this really gonna like do anything for the patient? You're gonna end up doing the same treatment that I do, but I'll just do it 10 times faster. I would just say, keep going. You're doing the right thing. Do what helps you sleep better at night, and if that means you're giving the patient a fair chance at taking control and making the right decisions for themselves, then I think it's worth it 1000%.
So, as a business owner, can you share two or three takeaways that has helped you grow as a business owner, and how did you navigate this space?
As a business owner, it's a lot of you don't know what you don't know. And I was trained to be a dentist, not a business owner. So I'm kind of learning on the job right now. I do come from a family of business owners. My dad has a business, my brother, my sister, my brother-in-law. No one's in healthcare, but at the end of the day, a business is a business, right? A lot of the same concepts and similar things. And I will say with business, one of the biggest things I've learned is there's a lot of trial and error. You have to figure out what works for your business. You have to figure out what kind of leader you want to be. And that will kind of set the tone for everything else. It's hard. And the other thing I will say is you have to have help. You have to have help from people who know what they're doing. So with the business, there's a financial aspect, there's like a marketing aspect, there's like systems in place in the office, all of those things. I couldn't do marketing if my life depended on it, right? Like I could try, but the best thing to do would be to hire somebody who knows what they're doing to do it for me because I don't know what I'm doing. Same thing with like taxes and financial things. Like my biggest piece of advice would be don't try to do everything yourself, right? People have done their training and have gotten really good at what they do for this very reason so that you can go to them and they can do it for you. Similar with dentistry. Like, don't try to do your own orthodontics at home. Don't do like those direct to consumer like models where you just like send a picture on Instagram and they send you treatment. Like, no, we all dentists went to school, did our training, did all of this so that you wouldn't have to figure it out. We'll figure it out for you. So that would be my biggest takeaway. Hire the right people to help you and who support your vision and who will help you grow because without growth, you're not going anywhere. And it's a hard lesson. I've had to learn, like, I've had a lot of kind of failures the first year, failures in the sense that some things don't work. So you have to pivot and you have to try something else. But I guess the main takeaway would be just keep going. Not everything's going to work. Not everything's going to work on the first time. Eventually, you'll figure out the right balance for you.
Thank you for that amazing advice.
Yeah,
So, how has being a mother influenced your approach to patient care?
it's made me a lot more understanding, that's for sure. Kids are incredible. They're just so pure and innocent, and you have to kind of approach everybody with that same kindness and empathy and help them understand. Mine are little, they're 6 and 3. So everything in the world is like brand new, and seeing the world through their eyes is like, wow. And holistic dentistry is kind of similar because for a lot of people, this is the first time they're hearing about it when they come to my office. So their eyes kind of like widen and they're like, what are you talking about? So it goes back to like our first appointment. Like honestly, I just spend like an hour talking with the patient. We don't even do anything. We just talk. And I answer all the questions and I explain everything I have to explain. And I tell them you're going to be overwhelmed. It's going to be a lot of information and we'll see you again at your next visit. And that's when we'll decide what you actually want to do. It's a lot to like digest and process, right? Imagine hearing about something for the first time and then you go to checkout and they're like, okay, when do you want to do this? And you're like, I don't even know if I want to do it. So it's a lot of parallels between like being a mother and seeing your kids grow and experience things for the first time and being the doctor and with your patients having them see and learn about things for the first time, and like just putting that little like seed in their mind that, hey, you have options. Now let's, think about it together and let's help you make that decision. Because even for my kids, I don't want to make decisions for them. I want to enable them to make decisions for themselves. So it's about giving choices, right? Do you want peas or carrots? You're still going to have a vegetable, but you'll get to pick which one. And even with my patients, it's, do you want to be, proactive and do things this way, or do you want to go the regular route? Either is fine, but at least you have that choice.
Yes, that's very good. So please tell our listeners if they want to reach out to you or if they want to book an appointment with you or they want to just talk with you, what is the best way to reach you?
Directly on our website, www.thrivedentalwellness.com. You can book an appointment there, or you can send us a text message, you can call us, you can email us. We're pretty good at getting back to everybody.
Well, thank you so much for your time and your insight. And I hope our listeners have these amazing takeaways that they can get after listening to you and this episode, and everybody takes their dental health seriously.
Yes,
So
thank you.
thank you. As we conclude our conversation with Dr. Artani, remember that true healthcare is about seeing the whole picture. This is Anisha Jennings reminding you that sometimes the biggest innovations come from looking at traditional places in a new light. Until next time.